Oh, what is this? Psst.
Pamela Breyer,
Here.
Dr. Simona Kwan,
Here.
Rosa Gill,
Here.
Dr. Mitch Katz, Dr. Sixto Caro,
Here.
Dr. Susan Klitzman.
Here.
Thank you so much. So Dr. Richardson is absent and Dr. Katz is absent, but is expected to join. So allow me to make my opening remarks, and then we will move on to the minutes and the business item for this meeting. Okay, and I see that Dr. Katz has joined. Dr. Katz, can you hear us?
Yes, I can. Thank you. And in a second, you'll see me as soon as I figure out what the right button is. Here.
Thank you, Mitch.
Here.
Okay, and I see you now. Welcome, Dr. Katz. So before we proceed with today's agenda, I wanted to take just a brief moment to provide an update on COVID-19 and our response. 1 year ago at this time, heading into winter, as you know, the number of COVID cases was also starting to rise, as we have seen in recent days. But unlike 1 year ago, when no one had yet received a COVID vaccine outside of a clinical trial, today the great majority of New Yorkers, 75% of the full population, have the protection of at least one dose of vaccine, and 80% of adults are now fully vaccinated. Also, compared to this time last year, we have many more tools to fight COVID-19 and to work to try to keep a winter wave at bay. This includes mask use indoors, ubiquitous testing and vaccination sites, with particular thanks to Mitch and H&H for their partnership, better ventilation, as well as monoclonal antibody treatment for people who are infected. Our greatest tool, of course, is vaccination, and I'm a believer that a picture is worth 1,000 words, and so I'm proud to share this graph that you see here on your screen, which shows our progress on vaccination against one of the severe outcomes that we aim to prevent: hospitalization. So the blue line is the cumulative number of New York City residents who are fully vaccinated. And the red line shows hospitalizations due to COVID-19. And I wanted to mention two more recent milestones, which are helping to extend the protection of vaccination. First is COVID vaccines for 5 to 11-year-olds, and the second is booster shots. On the first, I just want to say, sort of on a human note, that it's been both just delightful and extraordinarily moving to see so many children get vaccinated, to understand what that means for families, including families who have lost loved ones, parents who have been lost over the course of the last 2 years, and now children in those families able to get the protection of vaccination. Over 80,000 kids between the ages of 5 and 11 across New York City have gotten their first dose of vaccine thus far. And with respect to booster shots, over 700,000 New Yorkers have already received an additional dose. But we believe that even more can benefit from a booster ahead of winter and the holidays. So we're making a renewed push on booster doses now. As you may know, earlier this week, I issued a commissioner's advisory to all healthcare providers, emphasizing our guidance and ensuring that there are no barriers to accessing a booster dose. The advisory states that adult patients are permitted to determine their own risk of exposure based on their individual circumstances. And this means that clinicians should not turn a patient away if they request a booster, so long as they're 18 and older, and it's been at least 6 months since a Moderna or Pfizer dose, or at least 2 months since a J&J dose. I also advise that healthcare providers proactively reach out to their eligible patients, particularly those 65 and older, those with medical conditions, and those who have received a Johnson & Johnson dose. So to wrap up my opening remarks, we have to use every single tool that's in our toolbox at this time and be even more relentless than the virus. And as always, I'm sincerely grateful to all of you, to the members of the Board of Health, for your expertise and your support during this public health emergency. So with that, let's move into the approval of the minutes from the November 1st meeting. First, are there any corrections to the minutes from that meeting?
Hi, it's Joel. I emailed in 2 very small corrections.
Thank you, Dr. Foreman. Are there any other corrections that board members would like to raise here? Thank you. I'm hearing none. For the minutes for the November 1st meeting, may I have a motion to approve the minutes as amended, incorporating the edits that Dr. Foreman has sent?
So moved.
Thank you, Dr. Katz, and a second.
Second?
Thank you, Karen. All those in favor?
Aye.
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 Any opposed? Thank you. The minutes from the November 1st meeting are approved as amended. We will now turn to the single item that we have on our agenda today, which is to discuss the order of the commissioner regarding childcare and early intervention. Today, I'm pleased to welcome representatives from 2 of our divisions here to discuss the order. Corinne Schiff, our Deputy Commissioner for Environmental Health, as well as Simone Hawkins from the Bureau of Childcare, as well as Emily Ashton, our Acting Deputy Commissioner for Family and Child Health, and Lydia Ledniak, Assistant Commissioner for Early Intervention. I will now turn it over to Deputy Commissioner Schiff.
Thank you, Commissioner. We are here today to propose a vaccine mandate in childcare and early intervention programs. To refresh your recollection, the board has already approved mandates for vaccination for city employees and certain city contractors, for staff in residential and congregate settings, for Department of Education employees, contractors, and visitors, for public school students who engage in high-risk extracurricular activities, and for employees of childcare programs that hold contracts with the DOE or with the Department of Youth and Community Development. And when the board approved the childcare mandate, you inquired about whether we would be coming to you with expanded mandates, and that is what we're here to do today. So today, we're asking the board to expand vaccination mandates to other settings for children, including childcare programs that do not have a DOE or DYCD contract, and providers of early intervention services. This order, which the commissioner signed on November 17th, aligns with these earlier orders. It would require childcare programs and early intervention provider agencies to exclude staff who don't provide proof of vaccination, and staff would need, who are not yet vaccinated, would need their first dose by December 20th. There's a timeline for a second dose. We set out that new hires must have at least the first dose before they begin work, and we set out the record-keeping requirements. The order would apply to all regulated childcare. So center-based programs, which the board is familiar with regulating under New York City Health Code Article 47, school-based programs under Health Code Article 43, as well as home-based programs, school-age programs, and subsidized childcare that are state regulated. And in addition, this would apply to all early intervention providers serving children in New York City. The order also requires staff and children who are over the age of 2 to wear masks, except when they're taking naps or eating and drinking, and allows for flexibility based on children's developmental needs. Masking is already required in most of these settings, but there is a small gap in coverage. And so there are some school-based programs and center-based care that are not covered by existing requirements. And we know how important mask wearing is as a mitigation measure. And so we want to close that gap. So our proposal to the board today is to ratify the November 17th order of the commissioner. And we are happy to take your questions.
Thank you very much, Deputy Commissioner Schiff. If there are questions, you can either raise your hand virtually or on the screen. Thank you. I see Karen's hand up first. Please go ahead.
Thank you, Corinne, for that overview. And it's always good to have a reminder of what we've passed beforehand. From my perspective, and I did raise this at the last meeting where we talked about contracted childcare, this is a very important order that does cover a gap that was apparent before. And I think the consistency is really important. The messaging is really important, and I fully support this effort.
Thank you very much for that comment. Dr. Foreman.
Thank you. I actually had a question. In number 3 on page 2 of the actual order, it provides for some individuals where face covering is not required, who are exempt from that. And I was thinking about protecting the in-home early intervention folks who sometimes do in-home, I believe. And it didn't seem clear enough to me about exempting other household members. I think the line reads, a face covering is also not required for an individual who is not participating in early intervention services, such as a household member, when such services are provided in a private home. And I'm just thinking about protecting those workers. I might add something like, as long as the household member is not present in the same room. It says participating in, but one could be in a room but not participating. I know that's a fine point, but I'm just thinking about wanting to protect the people who are providing those services.
Corinne, do you want to address
Well,
that?
so I know it was carefully crafted, and I wonder if Lydia, if you want to speak to what we are trying to do here and whether this amendment would work.
So the way that the language is crafted now, we believe does very specifically address the issue that you are bringing up, and in fact, we get much more granular about that in our implementation guidance. But if you feel like it's necessary to amend that language to be even more specific, I think that it would work as well. We're very careful about being very clear that anybody who's participating or in the space where early intervention services are happening between the provider and the child must be masked. But we want it to be clear that if somebody's on the second floor and not participating in the session, then that masking was not required.
Thank you for that response. I agree completely, and that was my thoughts exactly. I would trust your judgment about the language, but to me, when I read it, it felt like it might not be crystal clear, and didn't want to put the early intervention services provider in a position of trying, of arguing with another household member who's watching TV in the corner or something with headphones on when it's in the same room. That's all.
Thank you, Dr. Foreman. I really appreciate that point, and particularly the concern for staff members. We have so many staff members either who are DOHMH employees or are contracted providers whom have been providing services often in patients' homes, throughout the pandemic, and so we do go to great pains to try to protect them. So I appreciate the sentiment. What I would propose, again, if you're okay with this, is that we leave the language in the order as it is, but particularly because EI is a place where the health department, can exert particular oversight in the implementation guidance that Lydia was mentioning. I do feel as though the spirit of your comment will be taken into account.
Thank you. That's very satisfactory.
Thank you. I'm just going to pause for one more moment to see if there are any other questions.
I just have one question I'd like to raise, which is, do we expect that the groups in New York City who have not been especially eager to be compliant among adults are going to be more strongly voiced around the issue of children? And I guess to that end, I would really like we could get a report, just an informal report after this goes into effect, say 2 months from now or 3 months from now, on how it's going in those resistant communities. I don't know how else to put it.
So we would be happy to come back to you. I think the time frame that you lay out is right, sort of late winter, after that we've had some time for people to come into compliance. And I think, as we have seen in all of these mandates, they are very effective. So our hope is, and people have adjusted, those who are in the contracted care programs, that has gone very smoothly. So we're expecting the same here, and that it will help some people who are not yet vaccinated become vaccinated.
Just a follow-up on that. I mean, I guess I'm particularly concerned about the sort of ultra-Orthodox and Hasidic communities, and how we're going to police those child care centers, and I guess the same way you do with measles vaccines. Yes.
Yeah, so we will be enforcing this. So first, in the same way that Lydia said that there's a guidance, so guidance is going out to programs in how to implement this. We will be doing, we've been doing education already about the importance of vaccination. We've held multiple sessions for childcare providers to boost confidence in the vaccine. And we'll be doing routine enforcement as we do for other childcare.
Fine. Fair enough.
Thank you very much, Pam. If there are no further questions, I will ask for a motion to ratify the November 17th order of the commissioner regarding childcare and early intervention.
So move.
Thank you, Rosa. And may I have a second?
Second.
Thank you, Joel. I'll now take a vote from each member who did not move or second just now. So we'll start with Dr. Sidney Hankerson.
Aye.
Karen Redliner.
Aye.
Pamela Breyer.
Aye.
Rich Katz.
Aye.
Simona Kwan.
Aye.
Sixto Caro.
Aye.
And Susan Klitzman. I did not hear from Dr. Klitzman. Do we still have her?
I think we lost her.
Yeah. Could have been.
Okay, I believe we still have quorum. Let me just check with Lisa.
Yes, we do, Commissioner.
Okay, excellent. So with a unanimous vote in favor of the motion carries.
Great.
And thank you. And that was our single item for today. So that concludes our Board of Health meeting. As always, and particularly ahead of Thanksgiving, I want to express my gratitude to each of you for what you're doing during the COVID-19 response. Thank you in particular for having made yourselves available with such frequency over the last few months. It has been so important for us to be able to respond quickly. And so I'm deeply grateful. Thank you so much.
Thank you.
Thank you. Happy
Bye.
Thanksgiving.
Thank you.